Last year, New York changed the process by which nearly 5 million Medicaid patients obtain prescription drug coverage. As part of that process, Medicaid patients lost many protections designed to ensure access to necessary medications. While some temporary protections were put in place initially, those protections are now gone. What has happened since the policy change took effect, and what will happen in the future?
So far, at least, the implementation of the managed care prescription drug card has been successful. However, there are still issues to continue to address.
My name is Lorraine Sepulveda. I'm the mother of Oben Pichardo. Oben is 10 years old, and he has been diagnosed with ODD, ADHD, a learning disability, and dyslexia. On September 20th, 2011, I received a letter in the mail which stated that my son's Intuniv medication was a non-formulary drug and it needed a pre-approval from a doctor. As October 1st passed, everything went through fine. Little did I know November would be the worst month ever. The evening of November 8th, I got a phone call from the pharmacist telling me Oben's medication was not covered. I thought it was just Intuniv 1 milligram and then Intuniv 2 milligram because that was the only medication on the letter. But it was the Concerta 2. My son was running out of medication, and having my son on no medication is not a good thing.
So you have experienced firsthand patients that have not been able to get medications?
Absolutely. When I first went through trying to get through the prior authorization, knowing that he was stable for so many years on this medication, I did not want to change him, or didn't think that it would be really therapeutic for him. I was denied that claim and ended up changing him to the same class of medication, which was generic and formulary. A couple of days after the change, this patient went to the emergency room with chest pains, had an extensive cardiac workup because the medication did not work as I hoped.
Okay.
So they should be able to stay on the medications if they are stable, not be changed just because this other insurance company doesn't have it on formulary.
Or that people didn't even know that this change was even happening. A number of people who we work with who are HIV positive did not receive notification, and the people who did only received it in English. We have a lot of clients who only speak Spanish and have very low competency when it comes to English. So even though they told us that they were releasing all of this information in multiple languages, many people didn't even receive it. I think most importantly, the most important recommendation is to reinstate prescriber prevails language. We want to make sure that if a provider is working with the patient and they believe that there's a specific medication that works, that they have open access to that, regardless of what formulary and what drug plan they have associated.
The new prescription carve-in is making our job more difficult, and so impeding our ability to care for our patients. The extra time and effort that we as pediatricians and our staff have to expend navigating the new system takes time away from our patients and has delayed necessary medications from our patients who consequently have suffered from that delay. That families should not be forced to confront additional barriers to care for their sick children because they are covered by Medicaid.
Well, the Hispanic Federation is mostly concerned about the lack of patient protections for the Medicaid patients. We think that a physician is the only person qualified to make decisions about the medication that a patient should be receiving, and that we should reinstate the physician prevails clause.
The state's new Medicaid prescription drug policy is not working. Something must be done. Patient protections must be restored in order to ensure access to life-saving medications.